You know, what does ADHD look like in girls, and why is it so different than in boys?
Well, you want to? I'll take a crack, Julie. You can.
Okay,
I
yeah, that
mean,
sounds good.
yeah, we could spend a lot of time talking about this, and I think Julie alluded to some of the differences. I mean, some of it has to do with expectations and the way that this condition presents itself. As Julia said, I mean, the girls are somewhat more likely to be diagnosed with inattentive type ADHD, and as many people probably know, the symptoms that are associated with that have to do with not paying attention, being distracted, being forgetful, losing things. It's oftentimes not the symptoms that are overtly causing problems in a classroom setting. And far and away, the main source of referral and the reason that kids start to get on people's radars for having difficulties is having challenges in school. So I think about it as the inattentive girl that is sitting in the back of the class, not causing problems for the teacher. They're going to be a lot less likely to get referred than the boy that might be more likely to be exhibiting hyperactive impulsive symptoms, up and out of their seat, making noises, things like that. But Julia, what would you add on that in terms of the presentation?
Yeah, absolutely. No, they're much less likely to cause waves, right, in the classroom and get that attention, to get the referral. There's also just in part because of societal expectations, girls tend to, they are expected to be organized and to follow rules and to pay attention. And so girls with ADHD develop a lot of coping skills typically to try to mask some of these difficulties. Even though these are very, very hard things for them to do, they're trying extra hard to cover up these difficulties, which leads to further delay in people knowing that that's what's going on. There also, research has shown that the girls with ADHD tend to have more internalizing symptoms, so more anxiety and depression. And that is typically what gets them seen by a mental health provider. And so they might get that diagnosis of anxiety and depression before ADHD is recognized and diagnosed and treated. We also tend to see that the girls often have more emotion regulation difficulties. There's some evidence to suggest this as well. And so that further is going to kind of cloud the picture a little bit in terms of the ADHD.